Thank you, Madam President. We are engaged in a very important debate on our budget over the last few days, and this debate will continue over the next several weeks and indeed for probably several months. It's not a new debate, and like past debates, at the heart of it are important programs for middle-income Americans like Medicare, Medicaid, and Social Security. And in some quarters, they're under attack. This doesn't have to be the case. In the 90s, Democratic majorities in the House and the Senate with the Democratic president were able to deal with this issue of deficit while preserving these programs and strengthening, indeed, in many cases, these programs. We were able to also provide the kind of economic growth that generated job creation, not just increased GDP or increased profits on Wall Street, but jobs on Main Street. Much of these efforts were, frankly, undone beginning in 2000 with tax cuts that did not, as advertised, produce the kind of private employment growth that were necessary for our economy, that shifted the burden to middle-income taxpayers while giving the wealthiest Americans extraordinary relief, and unfunded entitlement programs like Medicare Part D, and two major conflicts, none of which were paid for. And so now we once again face a situation where we have a significant deficit and we need to address it. President Obama has begun that process. He's begun it, I think, with the same commitment to maintaining Medicare, Medicaid, and Social Security, not without reforms and strengthening, but making sure that middle-income Americans and all Americans can have access to these vital programs. Now, we have taken significant steps in the long run to reform our health care system with the Affordable Care Act. We hope that, at least I hope, that that act is implemented efficiently and effectively so that we can begin to realize long-term savings to bend the proverbial cost increase curve of our health programs, not just our federal health care programs, but our health care costs across the board that are borne by private insurers as well as public programs. In fact, ironically, it seems to me that one of the major accelerators of the Medicare program is the fact that so many Americans, about 40 million, don't have access to consistent quality health care now, and yet when they turn 65, they have, by right, access to a panoply of services. I've had discussions with doctors, and they will tell me, you know, they say several times a day to their new Medicare patients, I wish I saw you 10 years ago, because I don't have to apply the expensive diagnostic and remedial techniques. I could have done something much easier, much less costly if you had coverage and access. So that's one of the long-term efforts we are underway, but we have to do a lot more to go ahead and to deal with the issues before us. Now, we have seen Republican budget proposals, but frankly, I don't think they strengthen the middle class here in the United States, nor do they provide the kind of sensible investment that will lead to job increases and to provide the opportunities that are necessary for the succeeding generations of Americans. They are, I think, more dedicated to an ideological commitment to simply reduce taxes. And that's something that has to be tested and should be tested in the history of the last several years. That was the same argument that was made in 2001. That such tax cuts would generate huge growth in private employment, unleash huge economic forces here in the United States, and frankly, over the last 10 years, that has not been the case. So I think we have to be sensible. I think we have to address the tax reform and tax reduction to middle-income Americans, not continually to favor the richest Americans when you come to tax proposals. And so much of what the the Republican budget seems to do is continue what they started in 2001. Huge, huge relief for the wealthiest Americans, but increasingly putting the burden on middle Americans. In fact, it's been estimated that individuals under the Republican budget making over $1 million would receive an average tax cut of $125,000 a year. And that's a huge, huge cut relative to whatever a working middle-income American might receive. Now, one of the other aspects of this budget is the impact that it would have on Medicare. Medicare is central to every family in this country. In fact, look around at not just someone who's earning a wage hour by hour, look at the small business person, the man or woman. Their retirement plan rests on the assumption that they will have access to Medicare. The Republican proposal, as I understand it, essentially ends that for individuals who are about 52 years old or younger. In the next 10 plus years or so, they're going to have to come up with a lot of money to pay for the Medicare that they assumed they would have received automatically when they retired at 65. And that's not just, again, the wage earner, the hourly worker who goes in there. That's the small business person whose post-retirement plan rests fundamentally on Medicare and then being able to buy a supplemental health care plan to that. So these are fundamental, and, in fact, earth-shattering proposals in my view. Currently, seniors on traditional Medicare pay approximately $1,700 annually in premiums. They're charged a limited amount for every hospital stay, have a reasonable deductible for every major procedure and treatment, and pay co-pays for services and prescription drugs. And they're even able to buy, as I alluded to, these Medigap plans, so they can supplement what Medicare provides with additional resources. And these supplemental plans are very affordable. On average, Medicare then spends about $11,760 on every senior. And that's just an average number, obviously. But this would all change, and it would inject a huge amount of uncertainty if the budget as proposed by the Republicans, that's still being debated by the Republicans, that's still being supported in many cases by Republicans, is in any way enacted. Beginning in 2022, the proposal, if the Republican budget were enacted, would be that every senior who becomes eligible for what we now call Medicare would be given $8,000 to address all the health care needs and then sent to the marketplace to buy health care insurance. Now, I guess I've reached the point in my life where I can reflect and remember that as a youngster in the 1950s and certainly before 1965, there was in practically every one of my friends' homes, a grandparent that was there because they didn't have access to Medicare or Medicaid. They were in a hospital bed in a living room or in some other room. They were being cared for by typically the mother, who was also trying to care for youngsters like myself and my contemporaries. And the reason was, regardless of how much money you had, is that at some point, insurance companies will not sell you insurance. You're old, you've had health experiences prior to that, you're a bad risk, and they're not in the business of insuring bad risk. That was, as much as anything, the genesis of Medicare. The recognition that the private health care market would not, regardless of your ability to pay, provide adequate coverage. And I think we've forgotten that. When the Congressional Budget Office, a nonpartisan organization, looked at the proposal, they essentially concluded that with this $8,000 transfer to a senior in lieu of traditional Medicare, that the senior would be on the hook for additional $12,500 in health care costs. In fact, it would likely result in some seniors in not even getting health care insurance at all, not being able to afford it, or at some point, particularly as they aged, getting to a point where no one would write them health care insurance because of the obvious health risks that they were. So This is a plan that I don't think that it comports with the reality of Americans that have already planned, and it's not just those who are over 52, but most Americans, to have access to Medicare, and also to the reality that what is proposed, an $8,000 transfer payment to an insurance company, would be inadequate to provide the kind of minimum coverage that we should be providing to our seniors. Now, we've had examples before where particular Republicans propose they have a new novel way to provide private health care insurance in lieu of traditional Medicare. When Medicare Advantage was established in 2003, seniors had the option of enrolling in private health insurance plans that were argued by the advocates as being cost-effective, would reduce costs, would put pressure on that public health care plan known as Medicare. 60,000 seniors in my state of Rhode Island enrolled. Private Medicare Advantage plans sell consumers on additional benefits and smaller copays. They went out very selectively, I suspect, recruiting seniors to come. I think recruiting in a way that they hope attracted the healthiest seniors, not the sickest seniors, because that would lower their cost. But however, in reality, most of these plans tended to cost more than traditional Medicare, as the smaller copays were largely offset by higher monthly premiums. And then, essentially, we were called upon repeatedly to provide more resources to a Medicare Advantage plan that was advertised initially as costing the government less. And I think we'll see that again as we go forward. So there are those that are still seriously proposing this Republican approach to Medicare. I think it will be a mistake. I think it would reduce access to health care coverage for seniors. I don't think the private market will jump up with the $8,000. I don't think you'll see that Congresses in the future will escalate the cost of these vouchers or transfers to private insurance companies in any way that would be commensurate to the real cost that seniors will face. And so as a result, I think this proposal will do serious harm to health care and to particularly to the middle-income Americans who, regardless of whether you're running a small business or working for an hourly wage, you will now face the prospect of the great uncertainty, the great unknown of no adequate health care coverage when you reach 65. We will go back in time to the period of my youth where, in fact, frankly, seniors did not have the kind of health care coverage they have today, and I believe the kind of health care coverage that they deserve. With respect to Medicaid, there are also proposals there. And the thought is that Medicaid is just a program for sort of poor Americans. But frankly, if you look at the statistics, there are 26,000 seniors in my state that are on Medicaid principally because of nursing home care. And we have to ask ourselves if these plans to provide block grants to states are enacted under the Republican proposal, whether those seniors still can maintain themselves in these nursing facilities, whether the cost will be so great on the states that they will be unable to keep up the level of effort, a level of support they are today. What seems to be inherent in all these proposals is not saving, but shifting costs, not reforming the system to be more efficient and more effective, but simply shifting the cost onto seniors, shifting the cost onto particularly middle-income Americans. And so, Mr. President, I would urge, as we review these proposals, that we would not accept, as we've been asked to, the kind of proposals that we've seen in the Republican budgets with respect to Medicare and Medicaid and many other things. And with that, Mr. President, I would conclude my remarks and I would yield the floor.